Nicole Surgeon, who has been a birth to 3 physical therapist in the Eastern Panhandle for 24 years, says any cut to Medicaid could threaten a service that's already stretched thin.
We do have a significant problem with practitioner shortage throughout the state right now in all 55 counties, and that's without a Medicaid cut. So if there is a Medicaid cut and our funding is cut at all, I can't imagine what that would do to our services.
We're also talking about practitioners who have not had a rate increase or raise in 22 years. There was an attempt this session, and although the 25% raise bill died in House Finance, some extra funds were put in their line item in the end, but there's still some uncertainty if that was even enough for raises or when those could be put into place. Medicaid cuts on top of stagnant wages could prove problematic, Surgeon says.
We would have a requirement to provide that service without the needed funds to implement it, which will be a real problem for our state.
With the proposed Medicaid cuts now in the Senate, West Virginia's delegation has said in recent weeks that the cuts are about getting unqualified people off and those who are on Medicaid back to work.
We want people back to work.
And that means that people that are ineligible should not be getting benefits and should be removed.
But Sargent says waste, fraud, and abuse in the system and people not working is a mischaracterization of the reality she sees daily, where the overwhelming majority are working families using Medicaid as it's intended for services and medical equipment.
It's important to educate yourself on the truths of what Medicaid does and doesn't do in our state and how it enables people to actually be more independent and more self-sufficient, and how, in my view as a therapist who has done this for a long time, taking that funding and those services from those people will do the opposite of what most people want to happen.
Now, I mentioned there is some confusion on when and if potential raises could take effect for birth to 3. I am still waiting on clarification from the Department of Health on that. Live in the studio, Anna Saunders, Eyewitness News.